Nicotine is the main addictive component of tobacco that motivates continued use despite its harmful effects. Nicotinic acetylcholine receptors, or NACHRs, are widely distributed within the human central nervous system, where they normally respond to acetylcholine and modulate neuronal excitability and synaptic communication. Nicotinic receptors are structurally diverse and have varied roles. Presynaptic and preterminal NACHRs enhance neurotransmitter release. Postsynaptic and somal NACHRs mediate a small proportion of fast excitatory transmission and modulate cytoplasmic secondary messenger systems. Although the impact of nicotine obtained from tobacco is not completely understood, a portion of nicotine's addictive power is attributable to actions upon the dopaminergic systems. This makes the user of the drug feel as though they are rewarded each time it is used. There are also various withdrawal symptoms that arise from corticotropin releasing factors that make the methods of quitting that much harder. Many studies have also shown that nicotine addiction is genetically inheritable, and the most prominent vulnerability to tobacco dependence is how great one's rate of metabolism is. As obtained from tobacco, nicotine activates and desensitizes NACHRs, and both processes contribute to the cellular events that underlie nicotine addiction.
The term cold turkey refers to the method of smoking cessation where an individual quits smoking without using aids to combat withdrawal symptoms. This method is considered to be very challenging as cigarettes are addictive, and because of this, the long-term success rate is 5%. There are no side effects with this method besides the withdrawal symptoms, some of which include headaches, anxiety, poor concentration, and restlessness. Overall, this method is not recommended due to its low success rate and the fact that there is nothing stopping the individual to go back to smoking besides their willpower. Behavioral therapy is used as people generally smoke emotionally, where they use smoking as a coping mechanism or stress reliever. Cognitive behavioral therapy, also known as CBT, is a psychotherapy technique that focuses on identifying negative thoughts and developing new ways of thinking about situations, according to the Association for Behavioral and Cognitive Therapies. CBT helps the individual gain greater confidence in their ability to stop smoking, explore any ambivalence about quitting, identify smoking triggers and find ways to avoid them or to respond differently, and to learn new ways to cope with stress and the urge to smoke. CBT is a recommended therapy to quit smoking as it assists with the ability to quit, as well as boosting the individual's confidence about smoking cessation and other aspects of their life. However, CBT can cost quite much. This accounts for a good therapist as well as the amount of sessions required. It is also difficult to find a therapist that is trained in CBT.
As we know, people have physical dependence on tobacco because of nicotine. They can cause unpleasant withdrawal symptoms when a person tries to quit. The nicotine replacement therapy can give the nicotine to the people during the quitting without use of tobacco and other harmful chemicals in tobacco. There are several types of it, such as nicotine gum, patches, inhalers, sprays, and lozenges. Many studies has shown using nicotine replacement therapy can nearly double the chance of quitting smoking. So this therapy can help relieve some of the physical symptoms so that people can focus on the psychological aspects of quitting. However, nicotine replacement therapy only deals with the physical dependence. It means that you will need another method to help with psychological part of smoking. In addition, as we can see, there are also some side effects during using nicotine replacement therapy. Medication for the people who are significantly dependent on nicotine should consider not only nicotine replacement but also drug therapy to help them quit. There are prescription drugs such as Chantix and bupropion. Chantix can help people stop smoking by interfering with nicotine receptors in the brain, which means that it will lessen the pressure a person gets from smoking and reduces the symptoms of the nicotine withdrawal. Some studies find out if the Chantix can be used at the same time as nicotine replacement therapy. It will tolerate it and safe. Also, it has side effects such as nausea, and vomiting. Bupropion is a prescription antidepressant in an extended release form that helps reduce cravings and symptoms of nicotine withdrawal. It does not contain nicotine, but it has impact on the chemicals that are related to the nicotine craving in the brain.
Chinese medicine aims to balance the energy within the body. Various forms of addiction, anxiety states, and system failures are seen as alarm bells of disease. Treatment is aimed at correcting the underlying patterns. Acupuncture assists people to quit by helping to regulate the actions of endorphins and neurotransmitters that are thrown into disarray when one stops smoking. Acupuncture can stop jitters, curb cravings, lessens irritability and restlessness. It can also restore balance in your constitution and jumpstart the healing process. There is also a point that is specifically used to stop smoking. Its purpose is to alter the way cigarettes taste. But will this point be enough? Well, of course not. Smoking is a complicated addiction. This acupuncture point must be used in conjunction with other points to combat cravings, restore balance, and heal. University of Oslo, Norway, conducted a study that confirmed that adequate acupuncture treatment may help motivated smokers to reduce their smoking or even quit completely, and the effect may last up to 5 years. Acupuncture may have effect of the person by changing the way cigarettes taste and their desire to smoke. Different acupuncture points have different effects on smoking habits. The Chinese herb category of lung yin tonic is often used to moisten the lung and mouth, which can prevent cravings and repair tissue damage caused by smoking. There is a Chinese herbal formula to calm the spirit that may be used for irritability. Many people use this formula to help them through stressful situations and prevent relapses. Labia tea, or green tea, can be sipped daily during the detox period to keep tissues flooded with elements that discourage nicotine cravings. Labia tea is traditionally used to rid the body of strong toxins such as snakebite. You can use 2 nicotine replacement therapy products at the same time to improve your chances of quitting. This combination approach is very effective. The patch is easy to use, but some may find 2 products too tricky to manage. You'll need to buy the lozenge, mouth spray, and inhaler, but in most cases, using the NRT in combination is cheaper than smoking. Using a combination of therapies is the most effective ways to quit. It is more effective than just using one NRT product, and it more than doubles your chance of quitting. If you add quitline to the mix, you'll have an even better chance of quitting. So to conclude, quitting smoking is always a good idea for anyone's health, but it is very difficult to give up the habit once and for all. Today we have discussed the damaging effects on the body and as well as some therapies to help you quit.